Thank you. Yes, I could talk about research all day long. This is my happy space. So first, let me just say, when I started my academic career, the first 10 years, I was in the Dallas-Fort Worth area, and most of my research there focused on health inequities in racial and ethnic minority populations, covering a number of different health outcomes. When I moved to Kentucky in 2013, my research started in a predominantly white, rural Appalachian population. And so I was engaged in research for 10 plus years with that population. And one day I will write the paper on what I view as some of the similarities in terms of doing research in both of those very different kinds of populations, because the social determinants of health are still the same in both areas. But there are clear differences as well that particularly tie back to population and community values and norms and culture. So my work in Appalachian communities, which is the eastern third of Kentucky, has focused on a number of different areas, but I think for purposes of today, I'll talk a little bit about some of the food insecurity work that we've done, in any number of communities, maybe 7 or 8 counties, I'm going to say. Whenever we walk into a community, my colleagues and I that do this kind of research want to hear directly from people who live there about what they view as the challenges, in this case, around obtaining access to nutritious foods, but also what the assets are, because I don't care how poor of a community you're working in or how geographically isolated it is, there are always assets in that community from which you can draw and build, to address the challenges, again, in this case, food insecurity. And so typically we do that in one way by creating a community advisory board to help guide the development or adaptation of interventions, which we then implement and evaluate in the community to try to understand what works and what doesn't work. And so to do that, again, you have to recognize what the values and the norms in that community are. So community advisory board members are typically individuals who live in that community who are not health experts. Every now and then we will include a nurse or a doctor, but more often than not, it's a high school science teacher or a farmer or someone who works at a nonprofit food pantry. Sometimes health department professionals. And these are individuals who live and work in this space, and again are in a knowledgeable space to advise us on what would work and what would not work in a community in terms of an intervention. And sometimes community advisory boards will advise us to undertake certain interventions that either are cost prohibitive or just not feasible within the time frame that we have. Or we may run up against other barriers. So one example that I can think of with a USDA grant that I have right now is our community advisory board said we needed to expand access to the farmers market in a particular community, especially among women who are receiving women, infant, and children, or WIC farmers market benefits. So these are women who have young children who qualify for these benefits, who were given vouchers to go to the farmers market, but they weren't redeeming those vouchers for some reason. So we collected some qualitative data to try to understand why they were not redeeming those, where they could get fresh vegetables and fruits for free. And so once we collected that information, we went back to the farmers market director and pleaded with him to expand access, and that was just not feasible. He wasn't interested. There wasn't the political will to be responsive to what we heard from our target population. So as someone who does this kind of work, you have to be ready again for rejection. Doesn't mean it wasn't a good idea. It just means it's not something that's going to work. And you have to be ready to move on to what the next thing is. So in this particular instance, through a lot of different relationship building, we were able to partner with a Head Start facility as well as Section 8 housing, and pull together a Master Gardener program, which was happening at the Cooperative Extension Office. The Master Gardener participants needed service hours, and so we had them plant in these raised beds at these two facilities, one specifically for low-income children and another for low-income housing families. And not only did we grow gardens in these two locations over this last summer, but we also provided nutrition education programming from Cooperative Extension. We're expanding upon that now by partnering with the Future Farmers of America chapter at the high school. So they're going to grow our seeds in their hothouse this winter, and then we will use those seedlings to plant these gardens in the spring. So I guess what I would say in sum here is that when you do this kind of work, you're going to fall down and you're going to fail all the time, but you keep going and you keep building relationships, knowing that they can mature into opportunities for collaboration. And so a lot of the work that we've done in this space has been connecting a number of assets together to benefit the community. In this space, it's looking for ways to expand access to nutritious foods.